Good afternoon, everybody. Welcome to this new episode of BHHSeries. So episode number 11. So today we're very excited about this episode. It's a very international panel. We've got people from 5 different continents, and we will discuss the situation about COVID. So COVID has been around for like nearly 3 months now. Like all the world has been affected by that, by invisible enemy. And people in countries have been dealing with the situation in different ways. So today, with our amazing panel, we're gonna discuss how things were handled in those different countries, what they learned from the other countries, what the disease before, and what can we learn from that, and what are the benefits that we will take for the future, how the world is gonna change after that. So I would like to welcome the panel for today, our speakers. So first we've got Tunde Salako, the CEO of Hadiel from Nigeria. Then we've got Dr. Gabriel Escalona, so trauma surgeon and chief product manager at Training Competence, and is in Chile. Dr. Aditi Joshi, so she's emergency physician and the medical director of JeffConnect, based in the US. Felix Owen, so the CEO of Kang Healthcare from Singapore. And Nicola Haywood, healthcare CIO and co-founder of Takeforce CV19, connecting from the UK. Welcome, everybody. Very excited to have you here with us today. So we'll start with Tunde. So we'll tell us a bit more about the situation in Nigeria and more broadly in Africa those past weeks.
Hi, everyone. It's excellent to be here and up. My name is Tunde. I'm the co-founder and CEO of Hadiel. We're a digital health insurance and software as a service platform, aggregating all participants and stakeholders in the health and insurance ecosystem by curating health data. We in turn churn out insights to be able to empower consumer behavioral health data and disease patterns for the purpose of fostering informed and empirical decisions. So in a nutshell, we're accelerating health insurance and inclusion via technology and data. I think we should just delve straight into it. Can I have the next slide, please? So just a snapshot of what is happening on this side of the fence. I mean, it's a unique situation because initially, for some reason, we thought we were in this because it was spurring up in every part of the world on March, when the COVID-19 situation finally arrived in Africa. It was going to take a longer time, or we thought we might never even see it. But alas, it did land here. And so we've been able to respond to it in different unique situations. This is just short of everything at a glance in Africa. As of Monday, the current situation, we have close to about 150,000 confirmed cases and slightly over 2,000 recovered cases, right? And unfortunately, we have death situation and the tolls are rising. It's was about above 1,000 as of 1st of June on Monday. Now, so the good part of this, the numbers are increasing. And why is that good for us? It means that the testing capacities and capabilities have actually increased over time, because the problem and the challenge we emphasized before was the ability to test. However, this has changed. You can see the numbers ramping up. And if you see the screenshot of the map of Africa, that encapsulates the 54 countries. And you can see where the red spots and the amber spots are in order of gradients. So without specific countries, the highest situation right now is about 35,000, or you're having numbers between 10,000 to 25,000 in no particular order, from South Africa to Egypt, and then in Nigeria, where as of today we're doing 10,818 confirmed cases. Next slide, please. So zoning it down to my country of origin, being Nigeria, So let me share a little bit of context as to what has happened. This is an overview of Nigerian Center for Disease Control, and all credits go to them for this particular slide, because this is actually snapshots from their dashboard. Now, what has happened is on a national scale and a national level, the Nigerian Center for Disease Control has been able to innovatively carry, the Nigerians and the rest of the world along as regards what's happening in terms of the COVID-19 situation. Now, as you can see on the left side of the screen, that shows a dashboard courtesy of the NCDC, where you have sample testing has been ramped up to over 65,000 as of today. And we have 10,818 cases. Unfortunately, total is at 314, and recovery at 3,289, and which leaves the active cases to just slightly above 7,000. So that's a unique situation in West Africa, in Nigeria to be specific. And trying to have been, starting from Nigeria inside out into the other countries of Africa, in Africa. They've done phenomenal work being the NCDC. And so what's happening is the government is responding. So private sector participants and companies such as ourselves are also responding in our own unique ways. If you see on the top right corner of this, that's the epidemiological curve of a state-by-state basis, the trends and the progression of the disease. As of today, we have Lagos being the highest, with the highest numbers of confirmed cases. And that's for obvious reason. Lagos is the economic and boisterous in Nigeria, even though not the confirmed capital. If you look on the lower bottom of the right-hand side, there's also a progression matrix, which the NCDC has been able to. And so what that means to us is, on basis, you can see which states are doing higher cases as opposed to the others. And so that lets everyone have an idea, innovative click of a view, to see which states are having more confirmed cases and where the hotspots actually lie, which therefore helps in turn to intensify contact tracing and every other thing that needs to be done. So holistically, this on a national level across the 36 states, which we have in Nigeria, all hands are on deck from Competence, and then the private sector is also pushing, to amplify certain things, which the government is also doing. If you go to the next slide, please. What you will see is a quick shot on response to what has happened on our own side. As Hadiel, we have created a digital telehealth suite, which essentially combines symptom checking, chatting with professionals, to telemedicine consultations with specialists. So we've had to revamp and work on this suite in partnership with Medictor, because we've embedded their API into our own backend API to be able to use and adapt their AI symptom checker to our local protocols. And so what happens is when you go on our link dedicated to COVID-19, whether you are high risk or low risk, and even get differential diagnosis as regards whatever diseases that you might be facing at that particular time, which means that you are now in a system that is being triaged, and you can navigate.
Okay, I think that maybe we've lost Tunde. There was the unstable connection on his side. Can we maybe move to Chile now?
I'm sorry. Yes, I think I went off briefly there. Sorry.
Yeah, we lost you.
It's probably the connection issues. But I can hear everyone loud and clear.
Okay.
Awesome.
So do you want to briefly finish your presentation?
Hello?
Yes, can you hear us?
Me?
Yes.
Yes, I'm back. So I'll just quickly ramp over this because I know my time is ticking really fast. So you have private companies that are responding, like I said, amplifying what the government has been doing. This has been our own response. That's a snapshot of what the AI symptom checker powered by Medictor looks like on the screen. And we're also working hand in hand with our sister company, which is Oncopadi, who actually delivers our tele-specialist consultation of our solution. You have other examples. I don't have an exhaustive list because of time. There's the EHA clinics, which is also doing phenomenal work in terms of
Okay, I think that we've lost Tunde again. Yeah. Shall we just let's just move to Chile. So Gabriel now will tell us more about the situation in Chile and in Latin America as well. I think it's very interesting because they're really like in the middle of it at the moment over there. Gabriel Rios.
Hi everyone, I'm very happy to be here. So if I can see my, okay. So as you said, we are in the middle. We're in the worst part of the COVID-19 here in Latin America. So I'm gonna try to resume all the things that has done in the continent, and maybe I came here and to learn about the experience on others. Right? Can you put the next one, please? So this is the photo, and you see Latin America is right now a hotspot. But if we think out of the box, it's maybe it's not such a bad thing for e-health. So you put the next one, please. So what's happening in LATAM? Well, COVID-19 is the leader of the digital transformation right now, because we know that it's the perfect tool to help us. What is going on here in Latin America? Could you give me the next one, please? We know that it's an infodemic right now, a pandemic and an infodemic. So the majority of the governments are using the SOME for good reasons and taking to get very low as possible of fake news and fake information, for misinformation for the patients, and they're using these social media resources to make the information faster and better for everyone. They're using chatbots for everyone, and they're using all the message from officials channels. You could put the next one, please. And I think that the big winner here in Latin America is telemedicine. And I mean, in these months, we have going through big steps in regulations that has been a very, very tough part in the application of telemedicine. In user experience, a lot of users in telemedicine in the governmental and the private sector too. And we have things like digital prescription, and we have things that payments that has been very, very hard in the most of the country. That has been a very huge step. And talking about apps, all the government have apps. Is a app for that. In Chile, Ecuador, Uruguay, Colombia, you have apps for triage, you have apps from symptoms, and you have apps from information. Not as well as tracing, but you have a lot of apps for information, so you can have the information right in your pocket. You put the next one, please. And the principal problem that, in my point of view, is the tracing and follow-up for the patients. And the tracing and follow-up has been very, very difficult. And the principal tool right now is the telephone. It's by calling and tracing and follow-up by calling. But a lot of hospitals, in my case, my hospital that is the biggest in Chile, Hospital Sotero del Rio, is making a tracing and follow-up platform. We have a tracing and follow platform from the government, but they're not very good assessed right now. And in all the sector, we have funding and collaborative partners than the PAHO, and with a series webinars, we're trying to share about the region, everything that we are doing. And here in Chile, we have funding from the government for innovation. This comes from platform Corfo. It's an innovation from COVID, and it's a lot of funding for making innovation. So how we can help, how we can go further in this. Next one, please. So it's still a lot of problems that I would like to discuss with you. It's about the seniors and technology, the access of internet, the security of the data. It's a lot of concerns about the security in the region. I think we have a lack of disruption, and I think lack of disruption, we don't have drones, we don't have robots already a few experience with that. We don't have in a plan, a governmental plan for that, and we have troubles in infomercial commerce. We had a lot of infomercial commerce, and it's all lack of tools to make follow-up for them, and as well the interoperability of the data and all the clinical records is a big problem here too. So that's what I have to say about that. This is our situation. We're going up in cases. We have made many technological tools where we don't have the answer already for this.
That's great. Thank you very much, Gabriel. And I would say I hope that you can also learn from the other countries that went through it already, and I can share some of the best practices that they learned, that we learned. So now we're going to move to the US, where it hit also quite badly. So Aditi, she's a medical director of JeffConnect, and they've been doing telemedicine for a long time. So she can also share the experience of that tool that's been raising in the past weeks, and also the situation in the US. Aditi, all yours.
Thank you. Thank you for having me. I'm happy to be here also. Not sure where my slides are, but I'm just going to start out. So I'm an emergency medicine physician. I work at a large academic hospital. So I saw COVID from that portion, but the other work that I do is in acute care telehealth, which we expanded to quite a bit within our own space and around the country. So we can go to the next slide. So there's a lot going on in the US. I know that people watch the news. I'm not going to get into any of the politics, but I just wanted to give the current numbers that we have. We're at about 1.8 million, over 100,000 deaths. I have heard that I pulled these stats yesterday from the Johns Hopkins Coronavirus Research Center. We've had about 5,000 more cases since then. And so it started essentially on our West Coast and slowly traveled. One of the unique portions or barriers within the United States is that our government does not have a centralized healthcare system, not really, and we do not have a centralized database. So everyone in every city is sort of handling it within their own way. We have a federal program that pays for insurance, but it only covers certain groups, whether they're under a certain income or they're in the senior citizen groups. Everyone else is either uninsured or has commercial payers. And so because of that, we had different experiences in different cities. So some cities had more PPE and the ability to get more PPE, and other cities and the ability to test, and others had none. So when we look at contact tracing and looking at other places that have been more organized about that, we don't have that because we don't have a standardized way and enough testing to be done to be able to tell where some of this came from. So unfortunately, we don't have a great picture about that. So the next slide. What I am going to talk about a little bit, aside from just the usual things that everyone had to do, including getting PPE and preparing their cities and institutions for staying at home and sheltering in place and creating testing site. I do a lot of telehealth, and this is actually spread around the country, not in just the city. So I'm going to give just an example of how we expanded it within our own place and how it expanded around the country. So like I mentioned, I run acute care telehealth. And so what we did for our institution, because we do that, we also do primary care, we do consults over surgery, and we do inpatient consults with telehealth. We were able to create and use every single one of those prior to Philadelphia getting hit by coronavirus. So our acute care direct-to-consumer platform was used for all screening and evaluation as we closed all of our outpatient clinics and most of our urgent cares. So over about 7 weeks, we had shut those down, and people were only calling either telehealth, they would go for outpatient testing, or they would have to come to the emergency department if they were deemed critically ill. Over that time, we saw about 6,500 patients. If you consider that Philadelphia is about 3 million people, and we kept that amount of people out of the hospital or any place where they could be exposed, it's actually significant if you were to march out that contact tracing. So in that way, we're able to really decrease the amount of exposure that we had. And like I mentioned, some of the other things that we were able to do was scheduled visits. A lot of our primary care and surgeons converted their visits to telehealth. In general, around the US, a lot of people were doing this. Places that had already had platforms or had programs did this a lot faster, such as ourselves. Everyone else had to do it very quickly. So what did not happen is using other digital technologies or apps, because most of what people were doing was actual provider to patient screening, because there wasn't time to use some of these other tools. But what it did help with was expanding, that's 4 minutes, expanding how many providers and patients engaged with telehealth. We expect that more people will use it going forward because of this, and it's going to be hard to go backward because many people got used to using it. Next slide. And then the last thing I want to do in this slide that nobody can read, I apologize, is that what really helped more than anything is that because of the emergency nature of this, the laws that prevented a lot of people from doing telemedicine or using any digital technologies were relaxed. The federal government created some emergency laws allowing people to see telehealth visits and basically bill for them, also expand who could do telehealth. But again, as I mentioned, because we have a disparate type of payment, states also had to follow suit, because if the actual individual state didn't allow it, it doesn't matter what the federal government does. Many of them did, and we still have some of these emergency laws in place, but it remains to be seen whether or not those will stay, because even though the federal government protects it, it isn't protected by the state. So a lot of these things are going to be some of the future parts of it. We have opened up very slowly. There's other things going on, creating a lot of crowds. And so we don't know what the next 4 weeks are going to hold, but we continue to do some of this work. Thank you, and I look forward to any questions.
Thank you so much, Aditi. Yeah, that was a great introduction. And yeah, we're going to talk a bit more about telemedicine after everybody, because that was a common theme for all the different countries. So now we're going to go to Singapore with Felix. So I think it's very interesting because Singapore and Asia will tell us a bit more about that. Was one of the countries that the rest of the world were looking at, because you control the curve quite well and quite fast. So yeah, exciting to hear about you, Felix.
Hi, good evening from Singapore. I'm Felix. I'm the CEO of Kang Healthcare, and I also have a healthcare startup called My Health Pass. So let's go to the next slide. And we'll skip this one, okay. So a bit about Kang Healthcare. I'm the founder and CEO of Kang Healthcare. What we have is a digital remote monitoring device. This was used in China not too long ago. And what we do is that we integrate both Chinese medicine as well as functional medicine. Chinese medicine was heavily used in China. And we have a machine learning device with an AI algorithms and push it out to a platform. So we'll talk a little bit about this later. It offers full aspects of both integrated healthcare. Integrated healthcare would combine both functional medicine as well as traditional medicine. Let's go to the next slide. The other startup that I have is My Health Pass. We built this product largely because of the demands that were coming up from North Asia. I do work a lot in Taiwan, in China, in Japan, and a lot of people, a lot of startups around the world were just focusing on test kits. We have what they call you're looking at vaccines, you're looking at treatment. But when all this is over, when COVID passes, how do we get people to go back to work? How do we get people to travel? How do we get people back into society? How will the new norm be like? So we built this, and we are currently doing various different engagements in North Asia. And we hope to roll this out through Europe and North America. So I'll share a little bit more about this as well. Next slide. We'll skip this, my background. So let me go to this slide. Now, the COVID started off in China late December last year. And the thing it says is that they raised the alarm. The first country that literally were alerted was Taiwan and Hong Kong. Now, when you look at Taiwan and with 23 million people, and you look at the numbers that were infected, the numbers of death, and the recovery rate, you have to be amazed at exactly what the Taiwanese did. And I'll share a little bit about some of their best practices and some of the methods and programs that they put into. Okay, but I'll talk a little bit about Southeast Asia. I'm back here in Singapore. I flew back end of February from San Francisco. So in Singapore, we saw the spike coming in sometime late February, running into March. And the thing about Singapore was that we took a very thorough investigative approach, meaning that there were a lot of testings, hence our numbers were very large. And sometimes people wonder, why our numbers are so high, but it's because we do significant amount of testings, okay? And because of that thoroughness, we create programs, we create test kits, okay, whereby we are able to develop significant amount of data collected to then be able to share this with a larger community. Moving ahead north in Vietnam, also in Southeast Asia, small, very, very small numbers. But again, when you look at the country, some of the countries around the region were fully locked down. Some of them were not locked down. And I'll share this a little bit as well. We go to the next slide. And this is North Asia, and that's where China, Taiwan, Japan, Korea, and Hong Kong. And I mentioned, in Taiwan, Taiwan has a awesome healthcare system whereby with the national ID card, the national healthcare insurance card, the numbers, they run less than 500 out of 23 million people, and when you manage that sort of population and that sort of programs, you have to be amazed. You have to give credit to the administration, to the policymakers, to the health authorities, and especially to the people. The people work together with the system to be able to better manage outcomes as well. And so so I will stop here. I will share a little bit more later as we go along in our Q&A.
Thank you very much, Felix. That was very, very interesting, very insightful. So now we're going to come back to the UK with Nicola, who can share us a bit more what happened there. And she can also share a bit about Australia. She has some good roots over there.
Hi.
Muted, no?
Hello.
Yeah.
Yes, I'm unmuted. Thank you very much. I won't go into too much detail about statistics around the UK. It'd be great if somebody can pop the slides up just while I'm just going through those stats. So far we have tested 1.8 million citizens. We've found 280,000 cases, and we sadly suffered nearly 40,000 deaths in the UK. We have identified that there is a greater propensity in line with ethnicity, so our BAM community seem to be more at risk, and also in our deprived areas where we have found that taking population and age into account, the death rates are around twice as much in our areas of more deprivation. If I could have the next slide, go on to sort of more positive things about what's been happening in the UK. This is just a collage of pictures of the types of activities that have been undertaken in response to COVID. There's been a significant move from on-site to online. Statistics are suggesting that we have around 45,000 members of NHS staff using Microsoft Teams for their day-to-day communications at any one time. There's been a significant move to telehealth and remote consultations, and around 20 million people are now asking for advice through an app that allows them to consult directly with their GP, and that's across the whole of the NHS. Our GPs now, 99% of our GPs can offer video consultations and 85% can offer online consultations. That's been an incredible movement, although that was already a strategic objective before COVID. But I think, as my colleague pointed out before, you know, who's been the key disruptor here? Not necessarily the CEO or the CIO, but COVID. Remote clinical decision making and diagnostics and contact-free medical examinations have been rolled out across many trusts and many healthcare settings. Obviously, there's been a significant amount of work put into COVID testing, antibody testing, and the track and trace. We have a manual track and trace process already live in operation, and we are just coming off the back end of piloting the app-based track and trace, which has been utilised in the Isle of Wight, which is an island on the south coast of the UK. We have been using bots and drones for medicines, for food, for drink. You'll be able to see a drone that was used for transporting medicines to islands, and you'll be able to see a little bot there. We've been using that to get food and drinks to staff and patients in isolation. We've put a lot of time into thinking about the vulnerable and the isolated, and I think that's really positive, because I'm hoping that that will be something that we will sustain going forward, because those were issues that already occurred. What COVID has done is put a much more social, shone a light on these things and given us a more social lens, and people generally have become more aware of these issues. Even down to how are we going to care for the homeless, and what will be our campaigns and our responses to supporting the homeless in the future. I've talked a lot about technology here, but I think we also need to talk about people, because they've been just as important as the technology itself. Whether that's been people coming together, such as the Army and the NHS, and building the Nightingale hospitals, which were our response to potential overwhelming an overwhelming need of intensive care beds, although those hospitals are being more repurposed as step-down beds. But I think it's also the nation has been hugely supportive. I mean, the British are very proud of the NHS. It's an institution, our public health service. And so, you know, from Banksy putting up murals around the place in celebration of the NHS, but also key workers, and the key workers are the people who care for people, teachers who've been looking after the children of key workers, people who've been managing all the transport and logistics, making sure that the right equipment is in the right place, making sure that shops are fully stocked up and that people can get food. It's really made us think as a nation as to who our most important workers are and how we value them. And I must also say that volunteering has been incredible. The public response was overwhelming, and the government has had more volunteering than they ever imagined from the public in general. So it's a real community spirit has emerged through this process. Well, I talked to people about how it's been isolating being in this sort of context. Yes, there has been concerns about isolation, not being able to be close to your loved ones if they live in a different household. Some people have found it rather difficult to be in their home and not be able to go out. Other people have actually enjoyed that experience and felt that it was quite, you know, they took comfort from the safety. Some people have talked about actually, you know, the one outing a day to exercise, thinking more about your food and drinking habits, because you had that time to do that at home, has potentially helped people's health. And also families talking about spending more time together. And so there's been a long sort of consideration around togetherness, but while apart. So sometimes some families have said they have done more Zoom calls and telephone calls to each other than they might have done in their normal busy day-to-day lives beforehand. We have obviously had the challenges, and I think the biggest ones have been around vulnerable people, people in isolation who are vulnerable, people who are vulnerable from domestic violence or chronic mental health conditions, and also the difficulty of dealing with grief if you again are disconnected or even in the early days couldn't even be there at a funeral or be there with your loved one in their last moments. That's been really difficult to deal with, but we have looked at how we can use technology in that way. Could I have the next slide, please? So what have been really the key highlights? When we look back on how we've responded, I think it's, well, when we need to, we can be responsive and we deploy at pace, and our decision making has been incredibly quick compared with how it is normally. That has been a reflection across the whole of the healthcare sector. There's been a massive ramp up of capacity, over 500 offers of support from industry, plus another 200 offers of resources from industry, plus the funding that the government has put in place. And there's been an immense speed of mobilisation. And when we need to, we can be creative and we can open ourselves up to new ideas and be hugely innovative. Our ability to solve problems has been significantly highlighted. We've been able to repurpose technology from other industries to the needs in health and care. And we've been building solutions at pace from scratch. I was told of one man who built the home services test kit for COVID-19 in just 8 days. Acceptance to change has been another big thing. So when we need to, we can employ new norms rapidly. And the frontline healthcare professionals have been incredible in the way they've embraced change and responded to it in a rapid method. And another colleague said to me, we've done in 3 weeks what we've been trying to do in 3, maybe in 13 years. We flipped our care on its head and we're delivering remote consultations almost overnight. And then I think there's the element about partnership working. So when you need to, you can do things fabulously together. Competition goes out of the way and makes way for collaboration. And so collaboration to deliver seamless solutions. And another quote I was given is, we left our badges at the door and just got on with it. We're united for the whole healthcare system. And also what that resulted in was giving greater attention to the patient experience, something that is close to a lot of people's hearts. Would you pass me on to the next slide, please? So this has allowed us to think about, how might our lessons from COVID help us to reimagine healthcare and what would be the key themes? We do focus on thinking of ourselves as a whole system, but we know that actually that can be quite challenging. It's very complex. The NHS is probably one of the most complex organisations and institutions in the world, and anybody who comes to work from it from outside, that's usually their first observation. But we have been thinking about, how do we hold on to our ability to be innovative, solve problems, to be able to mobilise at speed and embrace change? How do we continue to collaborate and focus on the patient experience and therefore address any health inequalities across our country? And so finally, I'd like to just introduce colleagues to a venture. If you could move on to the next slide, please. I'm a co-founder of this venture and it's called Tech for CV19. And it was really set up to help us bring people together, because all aspects of our healthcare industry, whether it was the users of healthcare technology or it was the providers of healthcare technology, whether it was people working in hospitals or it was volunteers helping people in care homes, it was really important that we could come together. And what we took from that was an immense sense of community. And so we've set this up now as a permanent venture. It's going to become a community interest company. And the values that the community has set, it's made up of over 900 different members from across the UK, is collaboration for competition, community for the greater good, the ecosystem for value, equity for equality, inclusivity for learning, listening for deeper knowledge, and peer-to-peer for partnership. Thank you.
Thank you very much, Nicola. That was a very positive presentation, focusing on what the good that happened this past month. It was great. Thank you so much. So now, everybody, I would like to talk a bit about the lesson that each of you in your countries have learned from what happened. So I think that's kind of was a first in the world, where the whole world was touched by, we say, one invisible enemy. And we still don't know too much about it. And so it started in Asia, then came maybe Italy, Spain, went to the rest of Europe, like UK and the US. then Africa, and Latin America. So we actually at time, we kind of saw the things coming, and we could have see how the other countries were living it before us, was handling the situation. So I'm curious to see, each of you, what did you learn from the previous country? So maybe we're going to start with Felix, and maybe that was a bit of a different situation because you had like the SARS in that part of the world before. So maybe you were more used to it.
Yeah,
like, did you learn from SARS?
I think back in 2003, the government of Taiwan, the government of Hong Kong, I believe they took very hard lessons from SARS. They saw a lot of death, and through the last 15 odd years, they have improved the entire healthcare system, public healthcare system. So therefore, when you go to Taiwan, okay, and I was there in late January, okay, they were already putting in place very, very strict procedures upon arrival in the airport. Okay, and moving ahead, the people on the streets, you could see that they wore masks, they observe very strict hygiene as well. So, meaning to say that it's about people, it's about the citizen having right policies, having right programs, having right structures is important, but it's also about the people. The people need to work with the system, and the people need to also understand and embrace that this system is beneficial for their family and themselves. Okay, so wearing a mask is not about protecting me, it's about protecting my loved ones, because you don't know if you are a carrier. 80-90% are asymptomatic. Going forward, you want to protect your loved ones. So a lot of people wear masks, and as such, therefore, it is also part of the Asian culture. So in Japan, in Korea, in Taiwan, in China, wearing masks was a part and parcel of their lifestyle. Okay, now where Taiwan's healthcare system is, and I shared a lot about how good they were, and I shared about, and also the numbers prove for themselves. It showed. They're just 1 hour away from the hotspot in China by plane, and they only had less than 440 plus infected patients. That's an awesome number. When what happened at the start of early January, they closed their borders. Okay, they closed their borders to China, and they had good reasons to. They wanted to make sure that they protect citizens as well. I think that is something that many countries did. So it's not about politics, or but it's about ensuring that there was proper care, and there was also ensuring that they took care of citizens' welfare as well. So that was something that I saw they were very quick to do. Back here in Singapore, the government got everyone to wear masks. Okay, and reason for that was that they knew that it could spread from people to people, and that's how the new norm will be. So in other words, we can say that the old norm is probably one that we could dine, we could marry in large crowds. The future may be a very different world, and we are going into a very different world, that social distancing is important, protecting oneself, wearing a mask is also important. So these are new norms that we need to be mindful about, and that was how lessons are learned, yeah.
But I think that's what you said. It's kind of it's a culture. Like in Asia, you may be more that culture, like the good of the community before like the personal thinking of oneself. And I feel that in Europe, it's maybe like people think about themselves, people thinking of the good of the community, for instance. Like, Aditi, I'm curious to hear about you, like, because you are like quite by numbers in the US. So what did you learn from what before? What could have been done better, maybe?
Sorry, I'm only laughing. I knew you were going to ask me. Oh, did you ask Aditi or?
Aditi, yeah.
Okay. So I think I'm just going to separate that question out a little bit by what we did learn versus what we recognized. And I think what we learned is because, yes, we weren't for the first place that was affected, that just the type of exposure, how fast it could spread, we did learn that. That's helpful when you're not the first place to be able to try and plan for that. What we recognized, and probably what people don't want to learn from us, is just the fact that when you don't have a standardized central place and ability to dictate, because there is a little bit of that culture of individuality, that it can spread things very quickly. Now, saying that, people did recognize it, right? And so there has been a change in a bit of the culture where scientists and physicians have a bit more say. People are listening to them. People have changed. They are trying to change their behavior, but obviously you're not going to change things that quickly. So I think that it's helped us understand that not having the ability to have a national way to collect data and look at trends is a big liability in these situations. It also is making us realize the huge gaps in our healthcare system, because when something is spread, airborne or respiratory, it doesn't matter trying to isolate yourself, it's going to spread. And some of these things have to be worked on from the ground up.
Okay, great. Can Gabriel, maybe from Chile, so you're in the middle of it now. So you've seen what has been happening in different countries. What are your challenges at the moment?
Yeah, so what I saw is that a lot of things happen everywhere. So you may think, or all the people may think, that the things that other countries did, you can did it as well, and that's not very true. It's not very easy. It's easy to say after you pass it, but before, when you are in different culture, it's very hard to say. So I mentioned before, we have a lot of low incomes jobs from infomercial, commerce and all that. But we learn as well, as Aditi said, that the scientific community have a very important role in the management of a government. So that's the thing that we are learning, talking about the government position. But I don't know what could we do better, because we are in the middle of this, and I have seen everything. I have seen from, I don't know, apps, lockdowns and dynamic lockdowns and high testing in Chile and low testing in other countries, and we are all like the same. I have a very good successful case that is Uruguay, that have, and talking about again from Aditi, they have a centralized data center from health and a centralized data system, and they are very good in numbers right now. But it's hard to say that if we had done a centralized data center, which is going to be better this, but it's very hard. But I think that everything is go by this way. We had here in Latin America a lot of assessment has been done from other countries, but is what it is. It's not very well, but we're going further.
And also now something I would like to talk about is telemedicine. So talking to each of you before today, like telemedicine is really something that came back in all the conversation that you had. You all agreed that that situation actually jumped the use of telemedicine. Like Nicola, for instance, you mentioned that in your presentation, that what has been many waiting years to happen took like weeks or days. So we've got a question from the chat. I think it's really relevant now. Like, what were the challenges when implementing telemedicine services those past weeks? You muted.
I don't think I am.
Yeah, now we can hear you. Yeah.
Thank you. In actual fact, it wasn't. That was the interesting thing, is that challenges that we'd had before seem to fall away. The necessity to move to telehealth and all the concerns that people had about utilising telehealth in a clinical setting, which was primarily from the clinical staff themselves rather than the public, the alternative, which was, not being able to facilitate social distancing, being able to minimize infections, be able to still give people the care and advice that they needed, sort of suddenly outweighed all those previous concerns. So it's like in Kotter's steps for leadership, you have to have, the first thing you have to start with is an unequivocal imperative to change. And that's what COVID did. Up to that point, there was always some reason why maybe it's not ideal, so we'll stay doing things the way we do things, and then suddenly it wasn't ideal to stay doing the way we did things, and that's really what's happened. And because we'd had that as a strategy for a number of years, the capabilities were there, the ability to roll it up, and to be fair, the industry responded incredibly, and that was a combination of people working hard hours, people just getting on with it, and people not actually going into competition with each other. There were challenges of getting teams, particularly for some of our providers who actually had global workforce. Obviously, they were then, I've talked to some CTOs who were working 24 hours round the clock to get the rollouts and to get the implementation done, because they were actually working with a global workforce as well.
So meaning that the work that has been done those past weeks of implementing telemedicine in hospitals, for instance, it is to stay after you think that they tried it and it will be adopted for the long run after COVID?
I think what people would ideally like, and I can't predict how necessarily this will go myself, but I think what people would ideally like, and I feel is the right way to go, is to look at maintaining those remote capabilities and then blending them accordingly, so that we're taking technology and the technology's there and people are more comfortable using it, but we integrate it with physical day-to-day delivery where that's appropriate.
Okay. Tunde, do you want to share a bit your point of view? Like, we also talk about that with you, like deployment of telemedicine in Africa. What were the challenges that you encountered, that the country encountered those past weeks? Tunde?
Can you hear me?
Yes, it's breaking up a bit, but yeah.
So I think, okay. So I think for us here, it's an evolving state, right? Because the way we access products and services is constantly evolving. The way we buy food, the way we buy drinks, supplies, groceries, basic day-to-day, they're pretty much evolving on this side of the fence. And healthcare is not left out, right? And so with that said, what has happened is, as opposed to the traditional means of working to a physical facility to access medical services, people are a little bit skeptical and wary in some parts of the country as of today. And why is that? Especially where you have the hotspots in certain parts of the country. Certain facilities, medical facilities, have actually had to shut down to observe goals before they reopen. So, which means that in such areas, what has had to happen is everyone is looking for alternative means to get access to medical care. And the only other means you have is don't go through a platform, is to call on a medic who happens to be your friend or a family relative to say, I'm experiencing XYZ symptoms, what can I do? Which is really not so reliable. So it's forced people to start adopting and adapting into the situation. And as opposed to couldn't have happened just last year very comfortably and conveniently, I think people are getting more comfortable with the advent of getting telecommunications via audio forms or video platforms, as the case may be. Because right now, the end user is very skeptical about having physical contact, right? And that's the same thing that we're experiencing in different parts. In South Africa, the same thing happening in Kenya, essentially in the burden parts of the continent. It's the same thing. And so it's kind of like catalyzed the process of being able to see a doctor actually and remotely. And I think people are just getting to ease into that new, and it's going to be something that would stay even after this COVID pandemic is over.
Exactly. Great. No, that's really great news. And so now I would like to talk a bit about contact tracing. So we've been talking about that a lot. Like some of you mentioned it in your presentation at the beginning. Like France launched their solution yesterday. So there were some people are not too sure if using it or not. So in Spain, we're also using, we're going to use the Google Apple solution. So they're doing a test right now in one part of the country in Canary Islands. And then if it works, they're going to deploy it the rest of the country. Felix, can you share a bit, because you've been using it, and also that was like at the beginning of the pandemic, everybody was looking at Korea, who were using an app to actually. So maybe can you share your experience, because people seems to be willing to use the solution over there. Right here in Europe, people are really a bit reluctant because of the data privacy. Like people are going to be tracking them with owning the data, what's happening to that data.
Yeah. So so the thing is this is that contact tracing and tracking. It's an integral part of post-COVID era, largely because one, we don't have a vaccine to prevent coronavirus. We have, if anyone falls ill and is infected with coronavirus, there's antiviral drugs that will deal with the treatment, but it does not prevent coronavirus from spreading. So in other words, contact tracing and tracking, it's a safety measure to ensure that both citizens, both the people, and also businesses can function in a safe and healthy environment. And that's important, for businesses, when you reopen, after shutdown and after lockdown or after circuit breaker, you need to make sure that your facility, your office is healthy and it's safe. Now, if you don't have a platform, or we don't have a system to safeguard your employees or your visitors or your guests, then you put everybody at risk. So it's an integral part. So right now, every country is deploying their own particular system. Okay. However, one of the most integral and most important part is actually air travel. Okay, because right now everybody is living and staying in their own country. There is very, very little air travel. Okay, maybe in the US, domestic air travel is still there, but international air travel is not there. Now, when international air travel begins, and you need international air travel for purpose of economic trade, businesses, So for that to take place, countries around the world need to have a common benchmark on who can I accept into my country, who can I not. So in other words, governments need to have bilateral agreements or multilateral agreements on how do they handle international passengers. That's really important. And today, at this present time, there is no golden rule. All right, and the international civil aviation authorities, they need to come out with a common and acceptable standards, okay, that airlines around the world can also apply, international airports can also apply. Whereas internally within your own country, you are then able to then determine on exactly how to use these platforms to safeguard our people, to safeguard businesses as well. Because if anyone falls ill, you know, in this, let's say you go to a shop, you go to a supermarket, and apparently someone was infected with COVID, then you literally know from the database on who was in that supermarket, you know what I mean? And you trace, you know, and that's important. And that's your duty of care. Okay. And yeah, so to me, and I built a product around that because there was requests, and I saw the requests coming from Taiwan and from Hong Kong on exactly what we need to apply. A lot of concern lies around privacy. Okay, this element of privacy is a question on what information are you providing and what information do the regulators or the authorities require. So different countries have different privacy laws, okay? And moving ahead wise, we need to determine on exactly how useful are these data that the authorities are gathering. All right. And mind you, again, like I said, when COVID may last anything, infection may last anything between 3 to 14 days. Okay, so you may be asymptomatic, you may not have symptoms, but it may come out within the period between 3 to 4, the third to the 14th day. So things like that is that we need to be mindful on exactly how to protect the people and the businesses together within the community.
Yeah. Exactly. No, makes sense in the context of going back to work, and absolutely, yeah. So as a closing question, because unfortunately we've come nearly to the end of that session, I would like to ask each of you to share some like positive takeaway that you take from those 2 months. So Nicola, for instance, you shared a lot already in your presentation, and also if there's one innovation that was born out of the COVID that was implemented in the hospital, for instance, or in the community, or etc. Aditi, do you want to start?
Well, firstly, I think the positive and is just the fact that the entire community came together, even though I mentioned that we are separated by laws and cities, but most of our community worked together well. There was a sharing of data within academics, doesn't always happen. Then we were able to take care of each other's patients. People helped each other in different departments. There was a huge amount of community, and I think that was great to see, and it was good for patient care. So that was one positive thing. As far as like the biggest things to come out of here, I mean, we mentioned telehealth. I think that is going to be huge, but it's only the first step. I think what will end up happening is just more of an expansion of what can be done at home. We have an issue in general with healthcare access, and this might be able to bridge some of that gap, whether it's from just having more people who are living in rural areas to be able to access care versus just places in the city that people can't see doctors. And I think that is going to be one of the biggest expansions, just because now that telehealth's on the move forward, gets paid for, people will want to actually do that and take care of some of this problem.
Thank you very much, Aditi. Tunde, do you want to share your positive takeaways and the innovation that may have happened in Africa?
So I think one is it's accelerated a lot of outside the box thinking, and it's fostering a lot of innovation. That is something that's going to continue to toe this line even after this pandemic is all over, right? And it's helped us close light years ahead of what we thought was impossible, right? And what I see is the fact that what people were not comfortable with prior to the pandemic it's really being to another zone of comfort. For instance, the access to healthcare, through tele consultations, audio consultations, chats, using symptom checkers like what we are doing with Medicta down here. So it's very interesting how behavioral patterns are shifting. And we're grateful for amidst all this, the opportunity to be able to accelerate outside the box strategies to be able to plug the gaps that keep showing up at time. Very interestingly is the advent of robotics, right? And so ordinarily what would have happened before will be, so it's most like Africa is usually the last to latch on. But it seems that this time what this is doing is Africa is latching on with the rest of the world at the same time. Give a very clear example is what is happening in Rwanda with the use of robotics in screening, preventing the health workers from being in the front line. They've actually teleported literally into the future, right? And you have robots in the healthcare facilities helping to screen this assessment with positive patients. That happened if it wasn't for the pandemic, and so that's a positive reaction, and it's already started in Rwanda. We're sure it's going to spread to other different parts of Africa, including Nigeria as well. So it's galvanized a lot of innovation, and we're forward thinking to seeing all the breakthrough to have on this side of the fence.
Thank you. Sorry. Thank you, Tunde. Felix, you want to share your takeaways from those 2 months?
Yeah, telemedicine and digital healthcare is here to stay. All right, there's no denying that, any doubt. All right, it will continue to evolve. It will continue to take a different form, but telemedicine and digital healthcare is here to stay. Hence, with machine learning, with augmented intelligence, and with blockchain, you are able to give real-time monitoring access to patients, physicians, and hospitals. So I think that is the biggest takeaway after COVID. I mean, prior to that, people were talking about digital healthcare, telemedicine, but they didn't know how to apply. They didn't know whether was it going to be widely acceptable. But COVID really pushed this into the forefront, into the hands of physicians, into the hands of patients, and I think that will be the baseline of public healthcare and global healthcare in the future.
Fantastic. Thank you, Felix. Nicola, your one takeaway out of all the lists that you shared before?
I think so. Just to quote a colleague, one person's big achievement is sometimes another person's norm, and I don't know whether there really was one single thing that was achieved over and above anything else in technological terms, because there were pockets of innovation and good practice going on around the place. So I think that's a really valid quote to say that one person's big achievement might have been another person's norm, but that shouldn't underestimate that big achievement. I would say though, one of the things that I did pick up was, people who had to isolate included our clinicians, included our health and care workforce themselves. And so it was really important that they were able to work remotely where that was appropriate. So where we've been able to use teleradiography and AI to be able to facilitate remote clinical decision making and diagnostics, so teams in the hospitals can reach out to consultants who might be isolating or specialists that might be isolating, was really valuable during this time. And I think the other one was the desire to develop technology to support those that were vulnerable and those that were isolated. So these were perhaps areas that hadn't been given as big a push, but really did prove to be invaluable and probably saved people's lives. And then I think the big takeaway is if we can hold on to our belief in our ability to change.
Fantastic. Thank you so much. Gabriel, the last word for you. So I don't know if you can really share like a takeaway since you're in the middle of the pandemic at the moment, but maybe an innovation, so something that you put in place. And also if you want to ask one of the other experts today their advice on something that you have a challenge with at the moment, just feel free.
Yeah, from the good things is I think this is the push that Latin America needs from the digital transformation, from this final digital transformation. And I'm very proud of the medical team and the nurses and all the people that works that have been working like a real team in all this. And everybody knows that if we are together, we are stronger. The innovation that I saw that like me most is the union between academics, industry, and all this in the ecosystem of innovation that has been working from problems and to solve problems, not to sell things, not to win political things. Is only to solve problems. That's the principal getaway. And the thing I want to ask is, do you have the data about the tracing apps, about comparing using tracing apps or not using tracing app, about the results in the population? Because I've been having very trouble to take data, like real data in papers and all this about the tracing apps.
Who wants to take that question?
So
Yeah,
yes,
Felix, go ahead.
There are some data that I have out from Asia. We can take this offline, and happy to share those clinical data with you or with anybody who would be keen to take a look at them. We pick up data at a very early stage. We picked up data at a recovery stage as well.
Thank you, Felix. Gabriel, is that what you were looking for?
Yes, I'm going looking forward for that. Thank you.
Perfect. Okay. Well, we've come to an end, and so I would like to thank everybody. I think it was really a great panel and a great representation of what has been happening, like on the global level those past weeks. A bit what Nicola was saying at the beginning, like everybody, like collaborating together to fight that invisible enemy, as I call it. So really, thank you, thanks everybody. I'd like to thank especially Gabriel and Aditi, they've been working on call at the hospital last night, and that they stayed up to be here for that live event. So thank you so much, Felix, also because it's very late in Singapore. You're still up for us. So yeah, really thank you everybody for joining. Thank you for following the event online today, and we'll see you next week, next Wednesday, and we're very excited because we will be live streaming from the Barcelona Health Hub next week. We're back. So that's very exciting. For those of you who don't know the place, it's beautiful. We're going to show it to you. So thank you very much. Thanks, everybody. Have a nice rest of the week. And see you next week. Bye-bye.